Hi, everyone. I'm back again here for the second part of the series, Fall Prevention, the Big Picture. Today, we're going to be talking about the environment, friend and foe, and how changes in the environment can dramatically increase or decrease someone's fall risk almost instantly. Okay, so before we get started, if you have not seen the first part of the series, I'll go ahead and introduce myself. My name is Emilia Bourland. I'm an occupational therapist. I also have my executive certificate in home modifications from USC's Leonard Davis School of Gerontology. I'm a former educator at Texas Women's University. There I taught in the Master of Occupational Therapy program, and my focus was on advanced clinical reasoning as well as hands-on clinical skills. I'm a published author and an expert on fall prevention, and I'm the owner of AIPC Therapy, which is a mobile occupational therapy practice dedicated to helping seniors live the highest possible quality of life as safely and as independently as possible. So if you're here today, if you're here at the second part of fall prevention, the big picture, then it's likely that maybe you have experienced fall either personally with a patient, a client, or a loved one. Maybe you're worried about safety, you're confused or unsure about what works and what doesn't work. Perhaps you've been let down by past fall prevention programs or education that you've had. You have concerns about liability due to falls with your clients or your patients. You need evidence-based solutions, and you want to do what's best for you, your loved one, your client, and your patient. Absolutely, that's the most important thing. This training series is really best for folks who are valuing safety, for families, individuals, and professionals who want to foster independence, who want comprehensive fall prevention solutions, and who want high impact strategies. Before we get started, this is a general fall prevention training program. It is not meant to be a substitute for individualized fall prevention programs or treatment of any sort of medical condition. So if you or someone you know needs individual fall prevention programming, if someone needs treatment for a health or medical condition, then please reach out to a licensed healthcare professional such as myself or another professional in order to get the help that you need. So we're going to start again here by defining what is a fall. And I think it's really important, if you didn't watch the first series, to really define what we're talking about here, because sometimes we think about falls as only being when someone hits the floor, but really truly there's a whole group of falls that are occurring. And if we pay attention to them and think of them as falls, then it allows us to step in earlier to prevent those really terrible, tragic falls from happening. So a fall, as we're defining it here, is any uncontrolled descent onto any surface or any attempted movement that ends up on the floor when the goal of the movement was not to get down on the floor. So that could be from standing, falling onto a bed, to a chair, sliding off the edge of the bed onto the floor, you name it. Some myths about falls that I want to go over again here today, so you really have them and have them in the back of your mind, so you can make proactive good recommendations. You can make good proactive decisions. So the first one is that falls are just a part of getting old, that falls are inherently related to age, and that we should all just expect that we're going to fall as we get older. That's absolutely not the case. The second is that it's okay if someone's falling as long as that person doesn't get hurt. Over enough falls, they are going to. It's just a matter of time. So we want to intervene before that happens. And then the third one is that the best thing to do to prevent falls is to immobilize the person. I tell you again, 99% of the time, when you try to immobilize a person that's falling, it's in fact going to lead to more falls, and the falls that do occur are going to have a higher level of severity of injury. But I'm going to give you some tools today to prevent you from having to do that. So this is our big list of why falls happen, and it's in every part of the series. The two that we're going to go over today are environmental hazards and poor fit between the person and the environment. Those two things are so big that we're dedicating an entire section of the series just to that. So let me start off here with a little story about why the environment matters in falls and fall prevention. All right, so this is a story about a gentleman in his 70s. He actually had really good balance and good mobility. He didn't have problems with those things, but he did have an advancing issue with low vision. He lived in a home that had a sunken living room. And he was having problems identifying the exact location of the step because he couldn't see it very well. And so he was having trouble with falls in that area. He did not want a significant aesthetic change to his home. And he also didn't have a large budget to do a significant modification. So what I ended up doing was along the wall that he would walk around as going into the living room, I put a series of tactile cues along that wall that he could feel with his hand as he was walking and would kind of tell him how close he was getting to the step. Then on that step, I actually put a clear non-slip surface there, like a clear non-skip slip strip there. And when he got to the place where he knew where the step would be with his hand feeling on the wall, he could then feel with his foot for that strip. And that would tell him the exact location of the step. And the outcome of that intervention was that he maintained the aesthetic appearance of his home. He had a lot of increased confidence in his own safety and his own home mobility. He did not have any additional falls off that step and was able to independently access his living room. It also improved safety for everyone in the household, including visitors, because of the non-slid surface that was then on the step. So the goals of fall prevention part 2, the big picture, is that by the end of the session, I want you to name at least 3 characteristics of the environment that can impact safety and independence. I also want you to be able to name at least 3 common issues or areas of the home that are high risk for falls. And I want you to understand the benefits of environmental modification as a tool to use when physical, cognitive, and sensory rehabilitation is either very limited or it's unlikely. So let's talk about the environment and how it impacts safety and independence. So the basic parameters of the environment are size, and that includes any physical item, whether it's fixed or it's unfixed in the environment, so whether you can move it or not, including the width, the depth, and the height, the shape of something, the sensory characteristics of that item or items. So the temperature, how does it feel on the skin? What's the color? Is it bright? Is there a glare issue? What's the smell of it? Does it make certain sounds? What are some other additional parameters of the environment? The weight of something. Is it firm or is it soft? Is it high friction versus low friction? One of my favorite things to say, people are annoyed by me, I'm sure, all the time because I love to say friction, friend and foe, but truly it is. And is the thing you're talking about in the environment, is it movable or is it fixed? So getting down into some examples of how the environment can impact safety and independence, let's just talk about some common things in everyone's home. So let's talk about flooring first. So carpet. Is the carpet high pile or low pile? So is it long or short? Is the carpet pad underneath? Is it thick or is it thin? If you have a hard surface, is that surface smooth or textured? Do you have grout lines if it's tile, or is it seamless? Another example, a couch versus a dining chair. A couch is very soft, squishy, often they're kind of low, versus a dining chair, which is more firm. And so we want to look at how would all of those differences interact in someone who had lower body weakness. So if you have carpet in your home and you have, let's say, a high pile carpet with a pretty thick pad underneath it. So, which honestly is what a lot of us like. It feels really good under your feet. It's kind of soft and squishy. And many people will actually install that because they're afraid of falling. They'll say to themselves, well, at least if I fall, I won't get hurt. But actually, when you have a soft, thick kind of squishy floor, it will increase someone's likelihood of falling because it requires more strength and stability from the body in order to stay upright. Think about if you're walking on sand at the beach. If you're kind of in that really loose sand that's further back on the beach, it's actually much harder to walk. If you're up near to the ocean where the sand is firmly packed, it's much easier to walk. It's an exaggerated example of the same thing. For hard surfaces, if you have wood, is it a smooth wood or is it a textured wood? If you have tile, do you have grout lines or is it so close together that you don't have any grout lines? So for someone who has lower body weakness, perhaps they're not able to lift their feet off the ground as much as they normally would when walking. So they might be much more likely to catch a toe or drag their feet and then trip and fall if the surface of the floor was not completely flush or had too much or not enough friction for their particular needs. The other example of a couch versus a dining chair. So when you try to stand up from a couch that's nice and soft and squishy and comfortable, a lot of the strength that you're using to try and move your body ends up kind of being translated down into the couch. So you can think about it if you're sitting on a couch right now and you push your hand down into it, the couch itself is going to squish. So the force you're using with your hand to push yourself up is not going into pushing you up, it's going into squishing the couch. That makes it much, much harder to stand up from a soft surface, particularly if that surface is low. It requires a lot more muscular strength. Now take, so someone with lower body weakness may not be able to stand up from that couch at all, and may end up in a situation where they're stuck there for a long period of time or could fall trying to get up from the couch. Now take that same person and put them in a firm dining chair. When they go to stand up, when they put their feet on the floor and they push through the armrest, all of the force that they're pushing down in there is going into moving their body and not into moving the chair. So they need less strength actually to stand up from that surface than they do from the soft, cushy couch. Some common environmental risks that are present in the home often, clutter, of course. We all deal with that from time to time, but clutter can cause trips. It can obscure other environmental hazards that might be in the way. For people who have cognition issues or dementia or other cognitive disorders, it can actually create a lot of visual noise that confuses their ability to use equipment safely, to use different strategies safely, and their ability to attend to the salient safety cues in the environment. So that can really impair independence as well due to increased distraction. So if you've got someone, you're trying to get them to focus on doing a particular activity, but there's a lot of stuff around, they're easily distracted, they're much less likely to be able to complete the activity that you're trying to get them to do. Rugs and uneven flooring. Of course, this is a popular item to talk about, and we all know that generally removing rugs is going to be safer than having rugs around. It's pretty easy to catch a toe or slip or trip on them, but even small gaps in flooring, thresholds, and even small slopes can really prevent someone from being safe and independent, especially if they're using a mobility device like a wheelchair or a walker. Those seemingly tiny obstacles can be really insurmountable with that kind of equipment. And of course, if someone is not walking as well as they normally were before, if they're not as strong, if they have a balance issue, then those small items can cause trips and falls as well. Unstable surfaces. So chairs with wheels, and I'm not just thinking about wheelchairs, I'm thinking of desk chairs, some bar stools, anything that has wheels is not necessarily the best safe surface for someone to be using. Unstable furniture that can sometimes be used inappropriately for support. If someone is, leaning on their furniture to walk or something like that. Use of towel racks for support when getting in or out of the shower, or use of improperly secured grab bars. Those are all pretty high risk items in the home. Slick surfaces, of course. So the shower and the tub is obviously what comes to mind. I generally recommend using the anti-skid strips or stickers rather than rubber mats. They tend to stay down and work a little bit better. They don't generally become tripping hazards themselves. For any sort of hard flooring, you want to make sure that the person is wearing the appropriate footwear. And of course, outdoor surfaces should be treated as much as possible to make sure that they're not slick, make sure that there's some kind of grippy surface on them, and handholds where there need to be for people. Poor lighting is a common issue that people don't often think of. So often people will fall when getting out of bed to use the restroom at night. Of course, everyone's a little bit disoriented when they wake up in the middle of the night to use the restroom. If the lighting is poor and you can't see the obstacles in front of you, if you have maybe a little bit of a balance impairment, and you're not 100% awake yet, it's an easy time and place to fall, and many people do. So one of the things we want to look at is, can the person turn on a light before going to the restroom without getting up first? How do we make that happen? Another big one is glare. You know, for folks with glaucoma or other vision problems, glare can be really debilitating in the environment. So we need to take steps to remediate that for them. Surfaces that are too high or too low are obvious places where people can fall as well. You know, beds that are too high or too low, toilets that are too high or too low, couch, chairs, recliners, etc. Of course, if someone is too low, it makes it very hard to get up to stand. They might fall during that process. If it's too high, then people can actually sort of just end up kind of like sliding and falling till their feet hit the floor, and basically, you know, hoping that they stay standing when they do. And so both of those things are problems to be addressed. So I want to talk a little bit about why environmental modification is such a powerful tool in fall prevention. If you did see the first part of the series going over all of that evidence, it's pretty overwhelming, and I wanted to talk a little bit about why. So the reason is that you can almost always change the environment, even if you can't change the person. And there are many things that we can do for people to make them better, stronger. And we will talk about that in part 4 more specifically. But when you can't change the person, you can change the environment, and it can make a huge impact. This is particularly relevant in folks who have fixed or declining cognitive impairment. So folks with dementia, people who may have metastatic brain cancer or advancing brain cancer, people who have fixed or declining sensory impairment. So I'm thinking of folks with neuropathy or macular degeneration, and people who have fixed or declining physical or neurological conditions. So thinking about folks who have ALS, Parkinson's, MS, amputations, cerebral palsy, etc. So let's go ahead and wrap up for this portion of the series. I think that you can see from what we talked about today, just even going over a couple basic types of flooring and different types of seating options, that the number of environmental interactions and the functional effects of those interactions are really exponential. It gets complicated fast. When you add the characteristics of the person and the requirements of the activity, the complexity of those issues really increases quickly. So for the highest level of safety and independence, really all 3 of those components need to match up, meaning the person needs to fit the environment needs to fit the person, and the activities that that person is doing within the environment, they really all need to match up in order to have the best possible big picture fall prevention outcome. When the environment does match up with the person, you're going to get increased safety, you're going to get reduced falls, reduced debility, reduced healthcare costs, increased independence, increased participation and initiation, increased confidence, and of course, what we're all after, a higher quality of life. So as I said, this is complicated. It's not necessarily something that that you are going to be able to just go and jump right in and come up with all of the solutions yourself, although I hope that you are able to take some of the information today and apply it in a way that works for you. But if you need fall prevention solutions, if you need individual training, customized training, staff or caregiver training, If you have an individual situation that really needs to be addressed by a professional, then please don't hesitate to reach out. You can call me. My number and my email is there for you. Feel free to reach out anytime. You can request a free consultation, get the recommendations that you need for the best possible solutions and options for you, your loved one, your patient, your client, whoever you're caring for. If you want more free tips, on the other hand, please visit my website. You can go to my fall prevention page and sign up for my fall prevention and independence newsletter. It's there for you. It's full of free tips and helpful information to help you live more safely, independently, help your clients, your patients live more safely and independently. And of course, I encourage you to watch Fall Prevention, the Big Picture, parts 1, 3, and 4. So if you haven't seen part 1 yet, I encourage you to go back and watch it, and definitely continue with me on to parts 3 and 4. I would love for you to take part in those as well. So coming soon, part 3, activities, why how we do what we do matters when it comes to falls, and how we can think outside the box for simple fall prevention solutions. If you have questions, concerns, comments, please reach out to me. You can call me, Emilia, at 469-998-1245, or you can send me an email. My contact information is there for you. Don't hesitate to use it. I would love to talk to you anytime. Special thank you to Kathleen Warshawsky and Seniors Blue Book. Thank you so much for hosting this, for making it available on your platform so that so many more people would have access to this absolutely vital information, so that they can be safe themselves, so they can make proactive decisions for the people that they care for. Again, if you have any questions or concerns, if you need individual solutions or customized programming, staff or caregiver training, please reach out. My number and email is right there. You can request a free consultation so that you can get the recommendations that are best for you, the best solutions and options for your personal custom situation, because there is no one size fits all solution. If you want more free tips, on the other hand, please go to my website, sign up for my Fall Prevention and Independence newsletter on my Fall Prevention page. And of course, watch the next parts of the series and go back and watch part 1 if you haven't already yet. So watch Fall Prevention, the Big Picture, parts 1, 3, and 4. And that's it for me. Thank you all so much. And thanks again, Kathleen and Seniors Blue Book. I look forward to the next session.